with respiratory disorders, here you can see that this is a disorder which is not included in your syllabus, so I am not going to spend much time on that, but still you can understand what is the term dyspnea. The term, wherever you are seeing the word this means painful. Pnea means breathing or respiration. So if there is a painful or difficulty in during breathing, that is known by the name dyspnea. And normally this dyspnea is associated with asthma, pneumonia, or like in the case of corona also there are people who are facing this kind of problem. So dyspnea is basically any kind of difficulty or labored breathing is known by the name dyspnea. Then we have the term known as hypoxia. In case of hypoxia, hypo means high means low, oxia means oxygen. So it is a condition in which body or a part of the body is deprived of adequate oxygen. That is low oxygen to entire body or to one particular part of the body. So if the whole body is not getting oxygen or any part of the body is not getting oxygen, we call it by the name hypoxia, low oxygen to either whole of the body or a part of the body. So hypoxia can be of two types. Here you can see that in case of hypoxia, it is either classified as generalized hypoxia or a local hypoxia. From the term itself we can understand, if the hypoxia or low oxygen situation or low oxygen condition is affecting your whole body, entire body, we call it as generalized hypoxia. Whereas if it is affecting only a part of your body, then we call it by the name local hypoxia. So these are the two different types of hypoxia that we are seeing here. Then there is some difference between hypoxia and a related situation known by the name hypoxemia. In that, hypoxia refers to a state in which oxygen supply is insufficient. So when there is a supply of oxygen in the atmosphere is very low, that is normally resulting in hypoxia. Where hypoxemia refers to specifically states that low arterial oxygen supply. So the difference is that in case of hypoxia, atmosphere may not be having enough oxygen. For example, you are going to a mountain area like Himalaya or Everest, then the atmosphere will not be having sufficient amount of oxygen. For example, yesterday I was seeing a channel and it was a then they are mentioning about people living in Tibet, and people who are having difficulty in breathing cannot go to such area because Tibet is located at a very high altitude. So if you are going from an area like us, and if you are having difficulty, problems with the breathing, you go to such area, the problem can get worse. So in high altitude, the oxygen content will be always low, and that is related to hypoxemia. Whereas hypoxemia refers to a specific situation in which your arterial blood will not be having sufficient quantity or sufficient amount of oxygen. So that may be due to low hemoglobin content or other reasons also. Then in hypoxemia, there is complete, if there is a condition in which low oxygen concentration or low oxygen condition is characterized by almost complete deprivation. Deprivation means absence. If there is complete absence of oxygen, that situation is known by the name anoxia. So A means absent, high means low. So one is low oxygen concentration, other is high, no oxygen at all. So that situation is known by the name anoxia. So here there are two related terms, one is hypoxia and other one is anoxia. So here what you can see in this picture is that how hypoxia will be affecting your body. So normally we are facing this kind of situation when we go to high altitude. In many high altitude we will be facing this kind of problem. So first symptom, the carotid body dictates low oxygen level in the brain and in the blood and will be alerting your brain. So that is how the first response will be coming. There is a cluster of structures in the carotid artery which is supplying the brain, and from there the message will be sent to all brain and different parts of the body, and the brain sends signals to the rest of the body, and the body will be responding by three types of action. One is increasing the breathing rate. So there is not sufficient oxygen in the atmosphere. So in order to survive, we have to increase the rate of breathing. We have to take more oxygen, so that is the only way by which we can get more oxygen. So one is increased breathing rate, then constrict blood vessels in the lung. So that is another contraction of blood vessels which are present in the lung. Then other technique is that increasing the heart rate. Heart will be working more and pumping more blood to different parts of the body. So that is a second response. It's also an effect of hypoxia. Then dilate periphery blood vessel in the arms, legs, hands and feet. So this is another example of effect of hypoxia. That is the whatever blood vessels are there in our superficial part of the body or peripheral regions of the body or this outer part of the body, they will be dilating or they will be enlarging, so that more blood will be flowing in that region. So that is another effect of hypoxia. So these are some of the common effects of hypoxia. Now coming to generalized hypoxia again, it occurs in healthy people when they are ascending or climbing or moving to high altitude area where it causes altitude sickness. So when you go to a high altitude area, you are feeling difficulty in breathing. That situation is known as altitude sickness. Sometimes it can have fatal complication, and this situation is a high altitude pulmonary edema. It's a kind of, then another situation is high altitude cerebral edema. If lungs is affected, we call it as HAP. If the brain is affected, we call it as high altitude cerebral edema. So these are the two fatal. Fatal means resulting in death. Then hypoxia also occurs in healthy individual when the breathing of mixtures of gases with low oxygen content. For example, you are diving underwater and you're taking a cylinder with you, and what happens during such situation is that you are breathing the same air you have exhausted. So your cylinder is attached to your body and you are taking oxygen from the cylinder, and the carbon dioxide you are releasing will be going to the cylinder again. And after some time, what happens is that amount of oxygen in the cylinder will be decreasing and there will be more carbon dioxide. So even though you are breathing normally, the air that you are taking in may not be containing sufficient quantity of oxygen. So that situation can also result in hypoxia. So hypoxia is also a serious consequence of preterm birth. Preterm birth in neonatal, that is neonatal means the babies which are in the early stages of their life are known by the name neonatal. The main cause of this, the lungs of human fetus are among the last organ to develop during pregnancy. So the problem is that when sometimes the babies may be normally the pregnancy term is 9 months and 10 days, or that is a normal term of pregnancy. But sometimes what happens is that the babies may be born after 6 months, sometimes by 5 months. So in such situation, the problem is that the lungs of the baby may not have properly developed. If the lungs of the baby may not have properly developed, it will not be able to do the normal working of the lungs. So what happens is that the baby may be getting sufficient oxygen, but it will not be able to supply this oxygen to the hemoglobin, and the body of the baby will be facing a shortage of oxygen. So that situation will be leading to hypoxia. Even though baby is living in an atmosphere with a normal oxygen content, its lungs is not able to work properly, and as a result the baby cannot supply sufficient oxygen. And that is a situation that leads doctor to take a decision in which putting the baby in an incubator or a ventilator for some time. So that will be supplying more oxygen considering the situation of the baby, so that extra oxygen will be given to the baby at a higher pressure level. So that device is known as an incubator. So this kind of situation can lead to hypoxia. So normally hypoxia will be experienced by a person when they are going to high altitude area. Another situation the people experiencing high hypoxia is during when they are diving underwater. Another third situation is that in case of preterm birth or that is in the babies having which are born before the normal gestation period. So these are the three situations that lead to hypoxia. Then we have asphyxia. Now in case of asphyxia, we have to understand that asphyxia is a condition of severely deficient supply of oxygen to the body that arise from abnormal breathing. See, asphyxia or asphyxiation is a condition of severely deficient, that is almost complete lack of oxygen to the body that arises from abnormal breathing. An example of asphyxia is choking. If somebody is holding your neck like this, and that will result in choking. That what happens is that the front part is the trachea, and if the trachea or windpipe is blocked or pressed, what happens is that your body or lungs may not be getting enough oxygen. So that situation will be leading to asphyxia, that is severely very much deficient, too much deficiency in oxygen. So a severely deficient supply of oxygen resulting in a situation known as asphyxia, and asphyxia generally causes generalized hypoxia, that is affecting the tissues and various organs of your body. And there are many circumstances that induce asphyxia, and all of which are characterized by an inability of an individual to acquire sufficient oxygen through breathing for an extended period of time. So if asphyxia is continuing for a long time, what happens is that our body may not be getting the oxygen it needs, and that will be resulting in coma. Coma means if the brain is dead, if brain is not working, that will make you in a situation known as coma. And if still the body is not able to recover, that will finally resulting death of the person. So asphyxia means almost near complete absence of oxygen is known by the name asphyxia. Then normally this asphyxia means talking anything that obstruct your airway. Sometimes if some object is stuck in your pharynx or in your larynx, for example some ball, in the case of some babies it happens, then that will lead to a blockage of airways, blockage of the windpipe. Then that will be leading to asphyxia. And there are certain situations called asthma. In case of asthma, people will be, the air may be there, oxygen will be there, but he may not be able to breathe properly, and that situation is known by the name asthma. Taking air may be extremely difficult for such a person. Then another situation is laryngospasm, that is this part of the body, the larynx, that will remain either in a contracted situation or in a relaxed situation. So it may not be contracting and relaxing properly, and that situation will be leading to asphyxia also. One minute. Okay. So what we were discussing is regarding this asphyxia, and we can see that asphyxia happens during extreme deficiency or extreme lack of oxygen, and normally anything that block your airway or constrict your airway or otherwise known as certain disease like asthma or laryngeal spasm or presence of some foreign material in your airway or in your windpipe can all result in asphyxia. Then being in an environment where oxygen is not readily available, for example under the water, this is what is happening when you are drowning, but there is below water you may not be able to breathe. So in the low oxygen, for otherwise you are in a chamber where there is no oxygen or in a vacuum chamber. So in all this situation, your body may not be getting enough oxygen, and that will be resulting in a situation of extreme deficiency of oxygen or too much deficiency of oxygen, and that situation is known by the name asphyxia. Basically it is a extreme form of hypoxia. Then we have the third one, that is the third disease is known by the name hypercapnia. Now regarding the hypercapnia, it is also known by the name carbon dioxide retention, and there is another term called hypercarbia, a condition of abnormally increased carbon dioxide. Elevated means increased. So if there is a higher higher level of carbon dioxide than the normal level, that situation is known by the name hypercarbia, otherwise known by the name hypercapnia. So hyper means above, capnia refers to the carbon dioxide. So this hypercapnia usually triggers a reflex in your body that will be increasing your breathing rate and access to oxygen. Such as, for example, when you are breathing, most of the time people may be breathing either with the head to one side. If it is happening like if your head is turned to one side, after some time your brain dictates that you are facing too much carbon dioxide, because you are sleeping with the head to that side because of pillow obstructing it. There may be too much carbon dioxide, and brain will send you a signal, and because of the signal it will produce a reflex, and you will be automatically turning your head from right side to left side or from left side to right side. So this is how we are turning your head from right to left or left to right while sleeping, because the body or brain senses that your body is having higher carbon dioxide level. That higher carbon dioxide level will be producing this reflex, and that will be resulting in turning of head. And sometimes there is a situation known as sudden infant death syndrome that is happening in babies, especially during the early age of the babies, maybe before 1 year or 2 years. What happens is that baby who is sleeping normally may suddenly die. What happens is that this is the problem, that this could be the possible reason, and why what doctors are saying that the baby may not be able to detect the increased presence of carbon dioxide. And if that situation is not being detected properly, this turning of head from right to left or left to right, if it is not turning properly, if it is not working properly, it is actually a nervous mechanism, and that nervous mechanism is not happening properly. What happens is that there will be increased carbon dioxide content, and there will be reduced oxygen content, and finally baby will be dying. And that situation is known as sudden infant death syndrome. Still our medical science cannot be able to explain why some children are dying like that, but their explanation is that this could be the possible reason. Then other is the symptoms and signs of early hypercapnia include flushed skin. Flushed means your skin become reddish. So that is the meaning of the flushed skin. The pulse becomes almost near the full rate. Then tachypnea. Tachy means high, faster. Pnea means breathing. You will be having a faster breathing rate. Dyspnea means painful or labored breathing. Then your heart will be working more faster. That is known as extrasystole. Too much systoles will be there. Too much heart contraction will be there. There will be muscle contraction or muscle twitches will be there. Hand flaps will be there. That is, hands will be feeling a certain feeling. Then reduced neural activity will be there. then there will be higher blood pressure, higher BP will be there. So this is the early signs and symptoms that your body is experiencing more than normal carbon dioxide level. So that is the symptoms. Then hypercapnia is generally caused by hypoventilation. Hypoventilation means low or poor ventilation, lung disease or diminished consciousness. So it may also be caused by exposure to environment containing high concentration of carbon dioxide. For example, you are going near a volcano or you are going near a geothermal vent where the gas will be coming from the earth, and that is the geothermal, or you are breathing the exhaled carbon dioxide. For example, when you are breathing using an oxygen cylinder, especially during diving underwater, you will be taking the same air again and again for some time. So the carbon dioxide content will be higher. So that will also lead to more than normal carbon dioxide content in your body. So all these situations will be leading to a condition known as hypercapnia. Basically, hypercapnia means a higher carbon dioxide level in your body or in your blood is known as hypercapnia. Then this is also, so hypercapnia or hypocarbia, an opposite situation. So what we were discussing is regarding the hypercapnia, and in your syllabus it is only mentioned about hypercapnia, but there can be an opposite situation. That opposite situation is known by the hypocapnia. Hypocapnia or hypocarbia is a state of reduced carbon dioxide in the blood. So normally hypocapnia results from deep or rapid breathing or hyperventilation. Your body is breathing at a faster rate. When body is breathing at a faster rate, this will be happening. The hypocapnia causes cerebral vasoconstriction. There is one problem. That is contraction of blood vessels in your brain, leading to cerebral hypoxia. Then this can also called a transient dizziness. Then visual disturbances. You may not be able to see properly. You will be having too much anxiety. So all these are actually contributed by the presence of low oxygen, low carbon dioxide content. So high carbon dioxide content as well as low carbon dioxide content both can create problem. A low partial pressure of carbon dioxide in the blood can cause alkalosis. Alkalosis means alkaline content in alkaline nature of your blood will be increasing, or your pH will be increasing. That is from 7 to 8 or 8 to 9. So that situation is known as alkalosis, leading to lowered plasma calcium ions and increased nerve and muscle excitability. So this is another problem. So if too much alkaline content is there, the amount of calcium available for the nerve will be reducing, and that will be leading to increased nerve excitability or nerve stimulation as well as muscle stimulation. Then this explains the other common symptoms of hyperventilation, like pins and needles. That somebody will be pricking you. Sometimes you may be experiencing that situation on your leg or on your palm or on your feet. You can find pins, that is in a feeling of pricking with thousands of pins or needles on your feet. Muscle cramps. Cramp means contraction. Then tetany means a state of continuous contraction, especially in the extremities. Extremities means your legs or arms. And so these are the situation that will be the result of hypocapnia. So hypocapnia is actually caused by presence of below normal carbon dioxide content. So you may be thinking that carbon dioxide is not needed by the body. That is not the case. A small amount of carbon dioxide is always needed by your body. It should be in your body. If it is not present, these kind of complications will be present. So this is the idea regarding hypocapnia. And so according to your syllabus, these are the three topics: hypoxia, hypercapnia and asphyxia. And hypocapnia is not mentioned for your sake only. I have explained what is hypocapnia. Then we have two more topics, that is the physiological effect of smoking is there and oxygen therapy is there. I think we will discuss those topics in another class because that itself will take some time. So I am stopping here. You can take 1-2 questions here.